Good morning, everyone, and welcome to Monday Morning Gentle Movement at Home. Great to see everyone here. Just a couple housekeeping announcements. I'm Jen Hanson, Director of Education at PNBC, and Neil Pearson is instructing today. Just a note that Neil isn't able to answer any specific medical questions or provide medical advice. If you have specific questions, please speak with your healthcare provider. We are recording this. The video will be available on our YouTube channel and on our Facebook page. There's a little poll at the end, which would be great if you could complete. And then if you do have any questions, you can just use the chat during this presentation. Neil and I will take a bit of time at the end and answer any questions you might have about the session and about moving within the session or any of the movements that he's trying. So if you have a question for Neil, please put it in the Q&A. And finally, we've got 2 more sessions this week, May 27th with Neil at 1 o'clock on Wednesday, and on Thursday, we've got Will Bateman, who has instructed before with us near the beginning of this program. So he's going to come back. He's at 1 o'clock. And then next Tuesday, unbelievably, we're in June already. And Neil's back again. I actually can't believe that now. Go ahead, Neil. You're muted. Oh, Neil, you're still muted.
Hang on a sec.
Oh, there you go. There you go. You're good.
I'm back? Yeah? All right.
You're back. Yeah.
All right.
No,
thanks, Jen.
Okay. No problem.
Okay. So welcome to the class this morning. We're going to do this class from a seated position today. If you would like to do some of them from laying down, certainly you can do that. A lot of the movements we're doing today are gentle movements of different parts of the body, and you can do a lot of them from laying down. But if you're all right moving to or starting from a seated position, let's start there. So all of these movements we're going to do today, actually all the things we do today, we want to follow the ideas or the guidelines of feeling like we're safe while we're doing it, so not pushing so far that we don't feel like we're safe. Having an idea that while we do it, we're not going to provoke things so that we will pay for it later or regret it later. And as we go through the movements today, we're going to focus on awareness. So sometimes when we're moving, we work on regulating our breath to keep our breath flowing in a certain way. And sometimes we can work on regulating our body tension. So for today, I'm going to take a bit of a switch. We're going to do gentle movements and it'll focus on awareness. So even with the awareness techniques, if you're feeling something that doesn't feel right, and if it doesn't feel like it's serving you today, then pause. You can pause, sort of regroup, decide whether you want to continue. And if it doesn't feel like the right thing to do, you can either just continue to sit and watch, or sit and breathe and do the movements that would feel all right. So to start with, find a nice seated position. If you can, sit away from the back of the chair just a little bit so your back's free and you get to use the muscles that help to support you up. Find a little length in your spine, not really sitting super tall, but just feeling like you're sitting a bit taller. Let your shoulders soften down a bit. Just for the beginning here, just release a little bit of tension. If you feel like you're tensed in your face or your jaw or your tongue or your neck, shoulders, anywhere, if you feel things are really tight, see if you can let that go just a little bit. And maybe you want to shift around or just stay still while you're doing it. Then take your attention to the sensation of your breath. Feel the sensation of the air as it's going in through your nose and the sensations of the air as it comes back out. Now, for whatever reason today you feel like you can't breathe in and out through your nose, that's perfectly fine. You can feel the air coming in and out of your mouth. So for now, just notice the sensation of the air passing in. Maybe you can feel it around the nostrils or the back of the sinuses or the back of the throat. And the idea here is to focus your attention on this sensation. As best as you can, notice the sensation all the way through the inhale and then all the way through the exhale. Now, as you notice your breath, you might decide that there's something you want to change. If you've changed it, that's perfectly fine. If you can let it be, if it feels like something you can just notice and don't worry about changing for now, just do that. So you've probably noticed how long it takes to breathe in, and you've probably noticed how long it takes to breathe out. If you haven't, just check in with that. So how many beats or how many seconds does it take to breathe in right now? How long is it taking to breathe out? And notice if there's any pause at the end of the exhale before you start to breathe in again, or if there's any pause at the end of the inhale before you start to breathe out again. Again, it doesn't really matter whether there is a pause or whether it feels like this smooth going from one to the other. Just notice whatever it's like. And then shift your attention away from the sensations of your breath around your head and notice what's happening in your body. So as you breathe, what happens to your body as you breathe in? And what happens to your body as you breathe out? You might notice movement around your belly. You might notice movement around your ribs, and you might notice movement around your chest. So you take your attention to each of those areas. And even with this, if it doesn't feel safe to pay attention to each of those areas, just pay attention to the ones that feel okay. And remember, you're not here trying to change how you're breathing, you're noticing what's happening. So as you do this, notice as well, is there any movement in the back of your rib cage? So can you feel any change in the lower ribs or the mid ribs or the upper ribs at the back of your body as you breathe in and as you breathe out? And then notice if the movement's any different right to left side. And then check back in again and notice the movement on the front and the back of your torso, your rib cage, as you breathe in and as you breathe out. And remember, if you've lost your breath or you felt like you need to pause, go ahead and do it. If you're feeling like it's time to put your back against the back of the chair and relax a bit more, go ahead and do that. If you're all right being out at the edge of the chair, stay there. Let go of your attention to your breath and shift your attention to the sensations of your body. So just wiggle your toes around just a little bit and notice the sensations down there in your toes. Let them rest now. And see if you can feel each one of your toes, your big toes, the second toe, third toe, fourth toe, fifth toe. Can you feel them all? Maybe you can, maybe you can't. It's all right. You might be able to feel temperature down there. You probably can feel the sensation of the toes resting on the ground. And that's all sort of outside things. Maybe you can feel some sensations from the inside, from under the skin in your toes. If you can't, that's okay. Just notice whatever's there. And then expand your awareness to all of your feet. So notice both of your feet, front and back. So all the different areas of your feet. Realize that sounded a little bit funny as I was saying all of your feet. So pay attention to all the areas of your feet. The tops of them, the outsides, the insides, the bottom. You can probably feel the sensation of your feet resting on the floor. And you might be able to feel temperature through the skin of your feet. And maybe you can feel muscle tension in your feet. Just notice whatever sensation is there. And each time you notice a sensation, just check it out for a moment. Like you can feel the heels on the floor, notice that sensation. Maybe notice, is it different from right to left? And then let it go. Don't think about it too long. Just let it go and look around for other sensations. And now do the same thing around your ankles and your calves and your shin. Notice whatever sensations around your calves, your ankles, your shins. You probably can feel some sensations around the muscles, around the skin. Each time you notice the sensation, just check it out for a moment, then let it go and look around. And this is the same thing you do if you end up feeling pain. So if you're exploring the sensations of your body and you feel pain, notice it for a moment. And then let it go and look around to see if there are other sensations there. Now take your attention up to your knees and to your thighs and notice whatever sensations are there. With your mind, scan through the inside of your legs and the outside of your legs, the backs of your legs and knees, the fronts of your thighs and knees. Each time you notice a sensation, then let it go. Look around, see what other sensations are there. And if you have pain in these areas, it can be really hard not to pay attention to the pain. So each time you notice it, then take your attention back to look for other sensations. Sometimes it feels like you're trying to look through the pain or under the pain or around the edge of it to feel the non-pain sensations of your body. Now take your attention up to your hips and your pelvis and notice whatever sensations are there. Scan through the back, scan through the front. Notice the right side and the left side. If you can, notice sensations inside and outside of your body. And then take your attention to your lower back and notice whatever's going on there. Maybe you can notice the position of your lower back. Again, if you happen to have pain there, just check it out for a moment and see if you can let go. Look through it, under it, around it to feel the non-pain sensations of your body. And then slowly start to work your way up your back. So you're noticing around the lower ribs at the back of your body, whatever sensations are there. The skin, the spine, the muscles. Then take your attention up even further so you're feeling around where your shoulder blades are. And in between your shoulder blades, notice whatever sensations are there. Seems to be a place where a lot of us get a lot of different sensations between our shoulder blades. If you've got something going on there, just check it out and then see if you can let it go and look for the non-pain sensations in that area. Then take your attention up to your upper back and across the top of your shoulders and notice whatever's there. Whatever sensations you feel. And then scan through your shoulders and your upper arms. Notice sensations there. If there's any pain or tension or discomfort, notice that. Those tend to be what our mind gets drawn to right away. If you notice those things, then let them go. Look around for other sensations of your body. Notice your elbows, notice your forearms, your wrists, your hands, your fingers and thumbs. Just scan through all those different areas and look for the subtle sensations of your body. And now draw your attention up to your neck and notice the sensations of your neck around the front and the sides and the back, whatever sensations are there. And then lastly, take your attention up to your head and notice the sensations of your head. Through the base of your head at the back of your head, the crown of your head, the sides of your head, your forehead. Don't spend too much time on any one spot. Just notice whatever's there. And end by noticing the sensations around your face, eyes, cheeks, nose, jaw, ears. And then release that. If you want to shift around, if you feel like you need to move after staying still for the last 10 minutes or so, go ahead and just shift around or stretch things out a little bit. And then we'll come back to this seated position. What we're going to do for the rest of this session is get you to move your body little by little. And as you do it, to pay attention to the sensations of your body as you move. So what sensations can you feel in your body while you're moving your body? But also notice what happens to your breath. So I'll keep on reminding you to check in what's happening with your breath right now, what's happening in the sensations of your body right now. If you happen to notice that your body is getting tense and you want to do something to relax it, go ahead and relax it. You can let go of tension in your body by breathing into that area or creating a sensation that you're breathing into that area. You can let go of tension by repeating in your mind, it's okay to let go. You can do it by changing your position. You can do it by stretching. So there's lots of different ways that you can do that. So if you do feel your body getting tight, or maybe the pain's increasing, then you've got these different things that you can do. Work on your breath, work on releasing muscle tension, stretch if that would feel best, or change your position. So we're going to start down to toes. So once again, take your awareness back into awareness of your body. So not just paying attention to my voice right now, pay attention to what's happening in your body, and just curl your toes under and then straighten your toes up and try to lift them, and curl your toes under and straighten them up and lift them. And just do that a few times. And as you're doing it, notice what's happening with your breath and notice the sensations in your toes. A lot of times we can pay a lot more attention to our big toes than the other toes, but just notice whatever sensations are there. And at the same time, as you notice what's happening in your toes and what's happening in your breath, maybe you notice other things that are happening in your body. So if you notice that other parts of your body are getting tight, maybe you can shift your position or try to do the movement without getting tense somewhere. I know sometimes when we try to lift things up, even down in our toes, you can feel your eyebrows and your face sort of lifting up as you're trying to really lift. And let your toes relax. So just take one of your legs now. You can either lift your leg up and hold it with your hands, just put your fingers together behind your leg, or you can just have your hands at the side, or if you want to, your hands can rest and you can hold your leg up. And now just move your ankle around. So point your toes, lift your ankle up, and notice whatever sensations you're getting there. So you're going to feel some things stretching. You're going to feel some things stretching one way, then the other, muscles contracting one way or another. Just notice whatever sensation's there. Now, if there is pain, don't go crashing through it. See if you can find that edge, that spot where you feel like, yeah, that's far enough. But if there is pain, see if you can feel other sensations there as well, besides the pain or tension or discomfort. And then let your foot come on back down on the floor, and we'll try the same thing on the other side. Same idea, you can hold onto your leg if that feels best, or use your muscles to hold your leg up if you want a bit more challenge. And then just start to point your toes and lift your ankle up. As you do it, check in what's happening with your breath. If you feel like you're holding your breath, probably best to let it go and keep on breathing. Check in with what's happening in other parts of your body. If you're holding onto your leg, make sure you're not getting too tense around the shoulders. If you're holding your leg up and you're feeling a lot of tension around your hip, maybe it'd be better to hold on to your leg and do less challenge. Or maybe that challenge is exactly what you want today. But down at your ankle, notice the things that are stretching. Notice the non-pain sensations of the movement. So as we go through this, anytime you start to feel any sensations of pain or tension or discomfort, see if you can find that spot with just the edge. And then also look for the non-pain sensations. So the idea of looking for non-pain sensations is not to ignore the sensations of pain or tension or discomfort, but to also see if you can feel these other sensations as well. So back to the first leg again, hold on to the back of the leg or lift that leg up and just do circles around. So try to get your soles to go to the inside and then out to the outside and back, and just go around like this. Notice what's happening with your breath while you're doing it. You can move your ankle faster, you can move it slower, wherever feels good, but feel the non-pain sensations or the subtle sensations of your body as you're doing this. And then let that leg down, try the other side. So part of the idea here is to start to notice more of what happens as you move, in part because we feel that a lot of times when we are in pain and we're exercising, that leg back down again, when we're in pain and we're exercising, a lot of times we ignore what's happening inside because of course we don't want to feel the pain. So we just do the movement, ignore the pain. And then sometimes afterwards, the pain is actually built up a lot. So the idea here is not to pay a lot of attention to the pain, but pay attention to the other sensations of your body as well, to see if they can give you some ideas of how much to move and when to stop. So hold on that first leg again, and then straighten the leg out, and then back down again. So only take that leg straight out to the spot that feels like the just right spot, right? You can lift your leg up higher and lift it out if you want to, or you can have it down low. Remember to notice what's happening in your shoulders, notice what's happening with your breath while you do this, and notice around your knee and through your leg the subtle sensations of your body. Notice the stretch, notice the sensation of the muscle contracting and releasing to do this. And remember, as you're going through this, we'll do the other leg now, but as you're going through, if you feel like it's time to stop before I stop, please go ahead. Don't wait for me. That's part of the idea of this, is to stop when you feel like that's enough for right now. Knowing that if you do that, you'll be able to come back later and repeat the movement. And it is that repetition and practice that's going to help us the best in the end with recovering function and ease of movement again. So let that leg go back down again. Sit far enough at the edge of the chair that you can get your legs out in front of you. So you need to make sure the chair is steady as you do this. And so now just let your legs roll out and then back in together. So just legs roll out and back in. Only so far as it feels good. If one leg goes further than the other, that's fine. You have the choice if that happens of maybe just moving one. If one's limited movement, just move them both that amount. That's often the best way to go. But as you do this, notice the sensations of your body. Notice what's happening in the muscles around your hips. Notice what's happening in your pelvis, your low back, your torso, your breath. As best you can, notice the non-pain, non-discomfort sensations of your body as well. And if you're still going, then stop. Bring your legs on back down, back in again. Feet resting on the floor again. Lift this right leg back up again and roll it out to the side and then back in. So again, notice the subtle sensations of your body as you're doing this. I know you're feeling the muscles contracting as you roll your leg out and in. If there's pain, don't crash through it. Just do it small enough that it feels like, yeah, that's the edge. I'll be okay later. Remember, as it starts to build as you're doing this, you can see if you can calm your breath, or you can see if you can calm your body. If it keeps building, then it's time to put your leg down and give it a rest. If you put your leg down, you feel like it needs to be shifted around, do that a bit and try the other side. So just roll it in so your foot comes to your other calf and then your foot rolls away. Just feeling that rotation, like your femur or your thigh is rolling inside your body, in and out. Don't worry if there's not too much movement, that's perfectly fine. And then put that foot back down on the ground again. If it would feel good to shift around, go ahead and do that. Next movement we're actually going to do is a bit of a lower back movement. So you're just going to let your lower back sort of slouch, like you're slouching with your lower back. You can keep the rest of your spine up, but just let your lower back round and then come into an arch. So from the side, you're doing this. So I'm trying to focus the movement down here. So same idea though. I'm paying attention to what's happening in my breath. I'm paying attention to what's happening in the sensations of my body. If I'm running into the pain, I'm just going to the edge. At the same time as if that's happening, I want to pay attention to the non-pain sensations around my hips, around my pelvis, around my lower back. Try to find a way that you can do it so you feel like you'll be okay later. You don't feel you're going to regret it or provoke it too much. If you're still moving, then pause, come back to that center position. Then shift your weight a little bit or your lower back a little bit so you feel like the weight goes onto like the sit bone on the left. You know, you can feel those bones that you're sitting on as you're sitting in a chair. So you can feel more pressure on the one side, more pressure on the other side. A little bit like the more weight on the left, you're trying to lift up your right hip. More weight in your right hip, lift up your left. Just back and forth. Notice what happens with your breath as you do this. If you can hear that creaking, it's actually the chair, not my back. Great, then come on back to the center again. Just pause for a moment. Notice again what's happening in your breath, what's happening in your body. Does it feel like it's time to take a little bit of a break? Does it feel like it's time to go a little bit, maybe push the movements further? Would that be a better challenge for today? Just sort of keep on making that decision as we go through these gentle movements. Now you're going to take your lower back and move it like it's moving around in a circle. So it's like you go over towards the right side and then slouch a bit, go over to the left, come into the arch with your back, and then the other way. Again, from the side, I go like this. Only so far as it feels like that's the right amount to go. Notice the sensations of your body as you do it, the sensations of the muscles contracting, the sensations of muscles relaxing. If there's pain or tension, notice that. Pay some attention to it, but not too much. So you can pay attention to other sensations of your body at the same time. Sometimes that's one of the keys to knowing how far to go. If the only thing that you can pay attention to is the pain or the tension, then that might be a key to maybe move less. So move into a spot where you say, yeah, I can feel a little bit of pain, but I still can feel other sensations of my body while I do that. And then come back to the center. Pause there, shift around if you want to. Lean against the back of the chair if you want to. If your breath feels like it's tight, maybe slow it down a little bit. And now start to move more of the spine. So let your whole spine come down, let your chin come down, and lift back up again. And as you do this, notice what happens to your breath. Notice what happens to the sensations of your body. So feel the muscles all the way along your spine. Feel the muscles around your belly as you do this. You might be able to feel things changing in the pelvis in terms of the muscles that are there, or even up in your throat as you do this. Maybe you notice things changing around your shoulders. So you're scanning through to feel the non-pain sensations, the subtle sensations of your body, getting more focused on those. And if you're starting to feel a little bit of mental fatigue from paying so much attention to the body, that's fine. Just do the movements. And if you starts to feel like you can come back to the focused attention, do that. If it feels like that's enough for today, then pause it, stop it, and focus on the gentle movements. Take your arms up in front of you. If you're okay with intertwining your fingers together, do that, or either you can put your hands together like this and just reach up and round your upper back and then come back, round your upper back, bring your chin down, come on back up again. Only so far as it feels good. Notice the sensations of your body as you're doing this. The stretching of the upper back and the back of the shoulders on the way forward. Maybe you can feel some stretch across the front of your body as your arms go back. From the side, the movement is this. So it doesn't matter if the lower back's moving a bit, you can hold it still or just move the upper back. And if you're still going, let your arms come back down again and just pause for a sec. Take your arms to the side so your elbows are bent at about 90 degrees and your thumbs are facing up towards the side. Just your arms up to the side this way. So palms are now facing the floor and back down again. As you do this, notice what happens around your shoulders. Notice what happens around your shoulder blades. Notice the sensations of your neck, of your face. Maybe there's changes happening through the rest of your back. If there's any pain, just go to the spot that feels like that's okay. So even if you're moving like this, that's perfectly fine. You need to find the right spot for you for right now and for today. Always remembering, and as you know, that the pain is a moving target, so you have to do different movements at different times of day, or push not quite so hard, or in different ways, different times of the day, different days. If your arms are still moving, let them down, let them relax for a moment. Take your right ear down towards your right shoulder, bring it back up, down to the side. And now that you have the movement, start to notice what are the sensations that are happening as I do this. Remember, if there's an increase in pain, just go to the edge and decide whether just touching the edge is the right thing to do today, or maybe today would be the day to not go so far. So yeah, there's the spot. I'm just going to move inside where the pain increases, rather than trying to sort of nudge up to the edge or push through it. But notice the other sensations as you do this. Notice what happens to your body as you take your head side to side. Notice what happens to your breath as you take your head side to side. And when you come back to the center from the left side next time, just pause for a moment. Take your attention back to your arms again. This time, have your arms straight down your side. Your thumbs are facing towards the front. Your palms are facing in. And then lift them up to the front, only as high as they want to go, and then bring them back down again. So you decide how high you're going to go with your arms and your shoulders. And as you do this, notice the sensations of the muscles that are engaging to lift your arms up. Notice what's happening through your mid-back and lower back as you lift your arms up and bring them back down again. Notice what's happening in your breath. Notice what's happening to the muscles in your face. So sometimes doing something as simple as this can start to make us tense around the jaw or the tongue or the eyes. Sometimes we can feel our breath pause or get tight if we go too far. Just notice whatever's happening. Then let your arms come on back down. Let them rest for a moment. Take your attention back to your neck again. Turn and look gently over top of your right shoulder, then come back to the front. Turn and look gently over top of your left shoulder, come on back to the front. So do this from a pretty good posture, from sitting up tall. And as you do it, find that just right amount of movement. If you feel sensations of pain or tension or discomfort, just go to that spot where you feel like that's okay. And as you do it, so once you've figured that out, notice other sensations. Notice what's happening in the muscles of your neck. Some of them are getting stretched as your head is going to the side. Some of the muscles are engaging. Maybe you can feel those muscles that engage when you turn your head to the side. Maybe you can feel them release as you come back to the center. Or maybe as you're doing this, you're noticing that the muscles are getting more tense. You're just trying to explore and notice whatever sensations are there. Maybe you can feel things in your head. Maybe you can feel sensations changing all the way down to your pelvis as you turn your head from side to side. And if you've already stopped moving your head from side to side because that was enough, that's great. If you haven't stopped yet, then come on back to the center. Pause and notice the sensations of your upper back, of your neck, your shoulders now. Notice what's happening with your breath. We're going to side bend the rest of our spine now. So we're going to actually start to the right side. So side bend your lower back and mid back down to the side, and then come on back up. Down the other side, come on back up. Find the just right spot. Notice the sensations of the muscles that are engaging, the muscles that are releasing. Notice any other sensations that are coming up as you do this. If today you want more stretch, you can take that opposite arm up as you go to the side. So you can take it up towards the sky while you go to the side, or you can try to reach over to the other side of the room as you do this. So either up straight to the side, or you reach across as you do it. Find the just right amount of stretch for you and notice the sensations. Notice what's happening in the muscles around your spine. Notice what's happening with your breath as you go side to side. If you've been using your arms and you feel like that's enough, but it's okay to keep on moving your spine, and go ahead and do that. Then come back to the center and just pause again for a moment. Maybe there's something that needs to be shifted around. Or maybe you're feeling okay just sitting still. Come back to the sensations of your breath, its length, its pace, that pause between inhale and exhale, the movement of your body as you breathe. Notice sensations in your body right now, just overall. Look for the subtle sensations of your body as well. We'll move into a twist now with our torso. So first come to the right. You can take the left hand to the outside of the left leg, the right hand to the back, or just have both legs resting here for a more gentle stretch. And come on back to the center. Same thing on the side. So this isn't about, for right now, it's not about seeing how far you can go. It's about noticing sensations. What happens to your breath while you do this? Its length and its pace, and the inhale and the exhale. Even the movement of your body is probably changing while you're breathing. The movements that have to do with breathing are changing because of the twist. And notice the subtle sensations of your body around your hips, around your pelvis, around your back as you go from one side to the other. You're still moving. You come back to the center next time, just pause. Feel your feet resting on the floor again. Feel that gentle length of your spine again. Bring your shin down towards your chest, let your whole spine round, and just be in a rounded position for a moment. So let your chin come down. Find the just right spot where you can stay. Find a place where you feel like it's safe. So if you've gone so far and it doesn't feel like it's safe here, it's perfectly fine to come back up a bit and find a place where you say, yes, that's all right. I think I'll be okay later. Notice the sensations of your body here. Notice the muscles that are being stretched. Notice the muscles that are releasing to allow you to come into that slouch. Just scan through your body and notice the subtle sensations of your body. There's going to be big things that tell you, like maybe there's tension or discomfort or pain, or maybe you can feel a stretch. You notice those things, and then as best as you can, try to look through them or around them to find the other sensations of your body. And then when you breathe back in again next time, come on back up. Draw your shoulders back and down. Lift your chin up just a bit. Lift your heart up just a little bit. Put your hands behind your body and either grab your other wrist, or if you can grab your elbows, do that. And so have your arms in this position. Pull your shoulder blades back and down a bit. Lift your chin up, lift your chest up a bit. And pause there. Notice your breath now. Notice what's happening in your body now. There'll be some big sensations that take your attention, so notice them. Attend to them. If you're in a place that you feel like that's going to provoke things, if I stay here, then change. Maybe don't pull your arms back down so much. Maybe don't pull your shoulder blades down as much. Maybe don't lift your chin up as much. Find that just right spot. Notice the sensations of your body while you're here. Remember, you don't have to wait for me. You can let go long before I say it's right time. If you are still there, then release your arms. Give them a bit of a shake around if it feels like that made your shoulders tight. Take your arms straight up from your body this way. Let your shoulders sink down a little bit. Feel your spine lifting up a little bit. And just pause right here. Notice the sensations right now. Curl your fingers in, straighten your fingers out. Notice the sensations of moving your fingers back and forth. Now, if your shoulders start to bother you to be out here, you can take your arms on down to the side and you can be here, or you can be here. Just choose whichever position feels like it serves you best today. One's not better than the other, they're just different. Notice the sensations of your fingers curling in, the muscles of your forearms working to draw your fingers in, muscles of the other side of your forearms to reach your fingers out. Let your arms come on back to the sides. Now that you've released the tension around your shoulders, notice the sensations there. Scan through the right shoulder, through the left shoulder. Notice the subtle sensations of your body. Maybe you can feel those muscles starting to release. Maybe it's taken more time. Have your arms at your sides, elbows about 90 degrees. Just lift up your forearms a little bit and circle your wrists around. Choose whichever direction you want to go with your wrists, whatever way you started first. And as you're doing that, find a pace that you can notice your breath and that you can notice the sensations. So as you do this, you probably can feel some sensations around your shoulders and neck from holding your arms in this position. Probably can feel some muscle sensations in your forearms, the back of your forearms, and this palm side of your forearms as the muscles are contracting. Try going the other way, see how it feels to do that. You're looking for the subtle sensations here. So there's going to be big sensory inputs. See if you can notice those, and then also notice smaller things, like what's happening at your elbows. You can feel the air temperature, the feeling of the air moving across your fingers, and then let your hands rest. If your shoulders are tight, just give them a little shift around. If your spine needs a break, sit against the back of the chair. Remember, you always can do that stuff. You do not need to wait. And the reason for this is that part of what we do when we have ongoing pain is that we often just keep on going even when things are starting to build. And that's part of the reason for the permission that you hear us continue to give, is that, to pause, to stop, to do what you need to take care of yourself. Because often we've learned not to pay attention to the alarm signals until they're way up there. And that's when we start to respond. And so part of this paying attention like we're doing today, and part of this having permission to pause and stop whenever you want, is to get better at noticing things when they're smaller. Because if you notice that when things are building up, when it's a sort of smaller buildup, then you'll be able to adapt to what you're doing. You'll be able to shift what you're doing, and in the end be able to do more. A lot of times people worry that if I always stop every time it gets a little bit louder, aren't I just going to move less? Well, the idea is, well, what you're going to learn is, yes, the alarm was getting a little bit louder. My breath was getting tighter. My body was getting tighter. The pain was starting to build up. And you start to notice that sooner, and then you can do things with your breath, with your body tension, with your mind, with your body, that will actually change how much it's building up. So you'll be able to do more with practice, not less. All right, so feel your feet on the floor. Push your feet down into the floor just a little bit. Reach your spine up a little bit taller. So you're trying to get a little bit taller. So far today, we haven't been working on anything that would build up any energy or force in the body. And let's move into a little bit of that right now. So feel your feet push down to the floor. So you're engaging your legs a bit. You may be even feeling your toes grabbing the floor a little bit, and that's perfectly fine right now. Use the muscle of your spine to get up a little bit taller. Use the muscles around your shoulder blades to draw your shoulder blades down just a bit, not too hard. If you pull them too hard, then you tense up too much. So just pull them down a little bit. Feel the muscles of your neck engage, so you draw the front of your neck towards the back of your neck. The muscles of your belly engage a bit, like you're trying to draw the front of your body towards the back of your body just a bit. So there's this gentle drawing in. Pushing down with your feet, drawing in through the spine and the neck and up towards the sky. And change your breath now. So you're doing lots of stuff. Same idea though, make sure that you're paying attention to the messages. Feel what's happening with your breath right now. And then start to make your breath longer and a bit bigger. And as you breathe in, feel your rib cage reaching out towards the sides and the front and the back. See if you can feel that all the way from the bottom of your ribs up to the base of your neck. So you're not feeling like your neck is engaging, you're not feeling like your shoulder blades are coming up, but you have more energy in your breath. So breathe in, it's like your torso is a cylinder that you're filling up a bit more, front and back and sides. And as you breathe out, engage the muscles that would draw them back in a bit. So think about your rib cage like a cylinder. So as you breathe in, you're engaging the muscles of your torso to draw it out to the sides and front and back. As you breathe out, draw back in again. At the same time as you feel your feet on the floor, the gentle drawing in of belly, the gentle lifting of chest, the gentle drawing in of the front of the neck. It's so much to do, but feel that increase in energy as you're working on this. So you can extend your breath so that you breathe in for 4 or 5 or 6 seconds and breathe out for 4 or 5 or 6 seconds. Do that. Don't ignore pain, tension, or discomfort. So if you're feeling that build, maybe it's time to shift what you're doing. And then let that go. Let your legs relax. Let your torso relax. Let your breath relax. Shift around if that would feel good. Then pause and see if you can feel everything releasing again. So that feels like it's enough, then pause there. If you feel like you can do that again, move back into it. And if you move back into exactly what you're doing and it starts to feel like it's too much, then that's enough. Just pause. We'll give you one more option of adding a bit more challenge. But for now, if you can, feel your feet pushing down towards the floor. Engage the muscles around your spine so you feel yourself lifting up like everything's trying to make you taller. So you can feel your legs engaged a bit, the muscles around your spine a bit. Your belly is engaged a bit. Front of your neck is engaged a little bit. Come back to that breath as you breathe in 4, 5, or 6 seconds. Slow inhale. Expand your rib cage to the sides and the front and the back. And as you breathe out, slowly draw back in again. You have to find the right pace for yourself. Find the right length. If you feel like you're running out of air, let your breath pause for a moment and try it with less length. So if you feel like it's time to pause, then pause. If you can stay here and it feels good, stay here. Feel that sense of energy in your body. If you can go one more step, then take your arms up towards the sky or straight out to the front or straight out to the side. So reach with your arms, whichever direction feels like the way that your shoulders and neck are okay with. So I'm going to go out to the side for right now. I'm going to reach my fingers, reach my elbows, my shoulders to the side. I'm still lifting up. I'm still expanding my rib cage as I breathe in, gently drawing back in as I breathe out again. So you're feeling that sense of energy as you breathe in, like the energy is coming from your feet up through your body, expanding your torso, reaching out your arms, reaching out the crown of your head. And then you continue to reach as you breathe back out again and draw back in with your breath. And if you can do it with a bit of a smile on your face, it's even better. If you feel like there's no way you can smile, you're probably trying too hard. Or maybe you just need more practice. If you're still there, as you breathe out next time, let your arms come down. Shift yourself down around a little bit, release the tension around your body. Put your back against the back of the chair for a moment. Let your hands rest in your lap. Close your eyes if that feels comfortable, or just soften your gaze. Check in. What's happening with your breath right now? Its length and its pace, the inhale and exhale, the movement of your body. Check in with the sensation of energy in your body. Do you feel like your energy is high? Do you feel like your energy is low? Does it feel like energy is in all of your body or only certain spots? Notice what's happening in your thoughts and emotions right now. And then if there's anything that you want to remember from this practice about awareness, then take to that spot so you can remember for a while, because I know in a moment Jen's going to come back on and she's going to ask you to complete a poll. So if there is something you want to remember for later, just try to hold on to that idea so that it'll still be there and you can write on down after you've completed our poll. Thanks a lot. We'll see you again on Wednesday.
Thank you, Neil. So I think everyone can see the poll. It's just up now. We do have a couple minutes. If anyone has a question for Neil, we'll just take a second to see if any comments come in or any questions. Okay. We did have one comment, which just was saying that they appreciate your explanations and the fact that you're repeating the permissions. So just people's permission to do what they feel is right, I think is really important. And Yeah.
Absolutely, I
Do you
agree.
want, yeah, I guess sometimes we feel like we're not not allowed to take it easy or not allowed to. We just have to keep push, right? We're all sort of
Yeah.
a little bit conditioned to do that sort of thing.
Well, I think that's a really, really important point, Jen. The idea that when we have ongoing pain, it's like our focus is always on challenging ourselves to push forward to get better. And so we have these two different other approaches. The approach like today of stepping back and spending some time to pay enough attention so that we can learn how to pay better attention when we do challenge ourselves to see if we can find a better challenge. And then the other option is to say, well, maybe the best thing I can do today is take a break. Maybe the best thing I could do to do today would be to work on calming everything down rather than trying to fight and struggle today.
Yeah, it's really learning to trust your own knowledge of your body, isn't it? Or that's part of it anyway.
Absolutely. Yeah, I think that's a big part. As a physical therapist, I learned, all my work with people with pain was at the beginning was all about trying to help people recover things. So all the goal setting was about do more, do more, do more. And it really wasn't until we started to listen to people in pain better that we realized that the people who were doing the best were saying, well, yeah, I do that, but sometimes what I do is instead of trying to push forward, what I do is work on trying to calm things down. And other times I just take a break. And so people were telling us that they did best when they combined challenging with calming and things that would give you a bit of a break.
Right. That's really interesting, and not surprising that those were the outcomes as well.
Yeah.
Someone's just commented that they have too much pain to sit for so long. So like I
Right.
think they're saying this session was a bit too much to spend sitting.
Yes, I mean that's always gonna happen. The difficulty we have with tolerating sustained posture. So my suggestion would be that use this kind of a practice, and when you start to feel like that's enough for now, just like we were talking about with all the other things, is to try to find that spot where you could stop. When if you stop now and you get up and you move around, that you will recover quickly. So it's just the learning of how long you can do it. And hopefully what will happen is if you continue to stay still and stop before it's really provoked, that over time that period will get longer as well. Sort of like what we do with movement. If you can, go ahead, Jen.
Oh, no, go ahead, Neil. Keep going.
I was going to say that it's like with movement. If we can move around to the spot where we feel like you're sort of at the edge of provoking it a little bit, but when you're done, you feel you can recover well. That people will say that over time, they start to be able to move with more ease. They can move further before the pain is provoked. And that's the same kind of thing that can happen with the stationary posture.
So Neil, just practically speaking, in this session, that might let's just try to unpack what that might look like in this session. So if someone were say they were sitting for 20 minutes and they felt like that was sort of brought them to their edge, they could stop, they could stand for the rest of the session or move around, and maybe return to sitting if it started to feel okay, or they could just take a break at that point and sort of do whatever they had managed to do and feel really good about that. Is that what you're saying?
Oh, absolutely. Yeah, right. So stay at that 20 minutes where the person says, yeah, that feels like it's enough. So move. And maybe you go move and you go off and you do other things and that's enough of the session. Or maybe you get up, you move around and you continue to watch it and you do imagery of the movements, right? But even though you're moving around, you could imagine that you're staying still, right, while you're doing it. Yeah.
And then like, would it be okay to return to sitting if you started to feel okay after a bit of movement? Yeah.
Absolutely. Yes. Yes.
Yeah. Okay. So just some options, I think, to consider. It's just such a, so flexible in terms of how you can approach this practice, isn't it? If you just use your body as a guide.
Yeah, yeah, absolutely. Yeah. So, and I think what you said there is the key thing, right? Is to learn to listen to the signals from inside that will give us more guidance. Because really, in the end, we know from experience and we know from science that pain is not an accurate indication of how much we should move by itself. It's not accurate enough. So we need to listen to other essentially alarm systems. And so we can pay attention to our sense of energy, our ability to breathe calmly, our muscle tension, the things that are happening in our thoughts and our emotions. Each of these areas can give us some clues as to maybe it's time to stop now. No one of those areas seems to be accurate enough on itself. So that's why we want to try to pay attention to a whole bunch of them.
Right. This, it's not easy, hey? There's a lot of complexity in this.
Absolutely. Right. And really what we're asking people over time is to become more discerning, to pay attention to these more subtle things, which takes time and takes practice. But then over time, you start to realize that in this scenario, it's your breath and it's your thoughts that are giving you the best advice. And in this scenario, it's something else. And you just, over time, we figure out the connections between the different areas to come up with a better solution.
Yeah, that's helpful. Thank you. I think we've got one last question. Someone is wondering if most of this session, I assume today, if that could be done lying down.
Absolutely, yes. Yeah. Yeah, I think trying to think of pretty much all those movements could, except you can't, if you're laying on your back, you can't put your hands behind your back, but besides that, I think you could do it all laying down. It'd be perfectly fine.
Great, great. Okay, thanks, Neil. I think that was really helpful. And I look forward to seeing you later this week. And I look forward to seeing everyone else next time.
Okay. See you Wednesday.
So have a great week, everyone. We'll talk soon. Bye.